To palpate the medial malleolus, you can have your starting point on the patella. From the patella, move medially onto the medial femoral condyle. Have you bend your knee just a touch? There we go. Onto that medial femoral condyle. Inferiorly, crossing over the knee joint onto the medial tibial condyle. And then from there, tracing distally along the shaft of the tibia, all the way along until you get to the medial malleolus, which is a very large bony projection at the distal aspect of the tibia. To palpate the lateral malleolus, you can start on the patella. From here, from here you're going to move laterally onto the lateral femoral condyle, crossing over the knee joint until you're on the lateral tibial condyle. From here, you're going to move posteriorly and just slightly inferior until you can feel the head of the fibula. And from there, traveling distally along the shaft of the fibula until you reach the lateral malleolus. And this is another large bony projection, and it's at the distal end of the fibula. So that's the lateral malleolus. To palpate the fibular shaft, you can start on the patella, move laterally onto the lateral femoral condyle, crossing over the knee joint onto the lateral tibial condyle, moving posteriorly and just slightly distally onto the head of the fibula. From here, I can move distally and I can palpate the shaft of the fibula. And this is an attachment point for fibularis longus. To palpate the medial cuneiform, or the first cuneiform, you can start on the distal phalanx of the great toe, going proximally onto the proximal phalanx, and then onto the metatarsal, the first metatarsal. I'm going to palpate for the base of that first metatarsal, and then just proximally to the base of that first metatarsal is the medial cuneiform. So if I palpate onto the plantar surface, okay, this is an attachment point for tibialis anterior. To palpate the navicular tuberosity, I'm going to start my palpation on the distal phalanx of the great toe, moving on to the proximal phalanx of the great toe, proximally onto the metatarsal. When I find the base of the first metatarsal, I'm going to cross over onto the medial cuneiform, and then just proximal to that, I can palpate the navicular bone. If I move from the dorsal aspect of the foot and I trace along the navicular, I can get onto the navicular tuberosity. This is a bony projection. It's quite prominent and it's subcutaneous. It's just below the skin, so you can feel it quite easily on the medial aspect of the foot. So that's the navicular tuberosity, and the confirmation for this is it's an attachment point for tibialis posterior. To palpate the head of the talus, we can start on the first metatarsal of the great toe. I'm going to palpate until I get to the base of the metatarsal. Proximally from there, I'm going to be on the medial cuneiform. Proximal to that, I'm going to be on the navicular bone. And then if I go one more movement proximal onto the next bone, I'm on the head of talus. So to feel the head of talus a little bit more, I can bring my patient's foot into plantar flexion, and that will slide talus anteriorly into my palpating finger. If I passively take my patient, just relax, if I passively take my patient into dorsiflexion, then talus slides posteriorly and I can't feel it as easily between the two malleoli. So make sure your patient's foot stays relaxed, because if they're actively dorsiflexing the foot, it's going to fire a number of muscles and ligaments that are crossing here, so you won't be able to palpate as easily. So when we're in dorsiflexion, it slides posterior and away from my palpating finger. If I bring the patient's foot into plantar flexion, then talus, the head of talus slides anteriorly into my palpating finger. What's interesting about this bone as well is it is the only tarsal bone that has no muscular attachment in the feet. Okay, so that's the head of talus. To palpate the Sustentaculum Tali of the Calcaneus, we can start on the first metatarsal of the great toe. I'm going to palpate down to palpate proximally to the base of the first metatarsal. I'm going to move on to cuneiform, the medial cuneiform, and then proximally again onto the navicular bone. If I move medially, I can get onto the navicular tuberosity, and then directly posterior from that navicular tuberosity, about 1 inch, okay, I can palpate the Sustentaculum Tali. Okay, so here my index finger is the navicular tuberosity, and under my middle finger right here is the Sustentaculum Tali of the Calcaneus. I can feel this bony landmark a little bit more prominently if I evert the patient's foot. It's going to slide that into my palpating finger a bit more. And if I invert the foot, okay, it's less palpable. It actually moves away from me. So to confirm, you can evert the foot to feel it more prominently under your palpating finger. And the Sustentaculum Tali of the Calcaneus forms a shelf upon which the talus, which we just palpated between the malleoli, the talus sits on this shelf-like projection right here. To palpate the medial tubercle of talus, we can start on the first metatarsal of the great toe. We can cross over proximally onto the medial cuneiform, proximally onto the navicular. If we drop medially onto that navicular tuberosity, we can move posteriorly until we get onto the Sustentaculum Tali of the Calcaneus. And from there, we're going to go about 1 inch, not 1 inch, just slightly posterior, onto the medial tubercle of the talus. So if this is the navicular tuberosity, this is the, just lift a bit slightly, navicular tuberosity. The Sustentaculum Tali is directly inferior to that medial malleolus. And then just posterior to that is going to be your medial tubercle of the talus. So the medial tubercle of talus is located just posterior and towards plantar direction from the medial malleolus. The confirmation for this is it's a portion of the talus bone and there are no muscular attachments to talus in the foot. To palpate the posterior surface of the calcaneus, we can start on the first metatarsal of the great toe, palpating until we reach the base of the first metatarsal, and then crossing over proximally onto the medial cuneiform, proximally onto the navicular, and then moving towards the plantar surface of the foot onto the navicular tuberosity, posteriorly until we reach the Sustentaculum Tali of the Calcaneus. And from here, we just want to go directly posterior until we get on to the posterior surface of the Calcaneus. So it's right along here, that whole posterior surface of our heel is the Calcaneus. And this is an attachment point for gastrocnemius. To palpate the styloid process of the fifth metatarsal, we're going to start on the distal phalanx of the fifth digit. we're going to cross over onto the middle phalanx and then proximally again onto the proximal phalanx of the fifth digit, proximally again onto the fifth metatarsal, and then we're going to palpate proximally until we reach the base of the fifth metatarsal. And so the base, if you palpate a little bit more lateral, the base of the fifth actually flares out. I'm going to lift you just a wee bit. Here we go. So here's the fifth metatarsal, and then as we get closer to the base, if you palpate on that lateral aspect and push medially and distally, you'll run into the base of the fifth, which flares out, and it is called the styloid process of the fifth metatarsal. And the conformation for this bony landmark is it's an attachment for Fibularis brevis, which attaches onto the dorsal surface of the styloid process of the fifth metatarsal. To palpate cuboid, we're going to start on the distal phalanx of the fifth digit, proximally over the middle and proximal phalanx of the fifth digit, crossing over proximally onto the fifth metatarsal. We're going to palpate proximally until we reach the base of the fifth, or that styloid process. From here, I'm going to drop off of the styloid process of the fifth metatarsal into a small depression. And this piece of soft tissue right here is where we'll find cuboid. So the reason that there's a bit of a soft tissue depression is that the base of the fifth metatarsal kind of flares out to the side, and then the lateral aspect of cuboid is a bit of a concave shape. So once you get off of the base of the fifth, you can apply your pressure medially, okay, and then you can contact cuboid in there if you direct your pressure medially. The conformation for cuboid is it's an attachment point for tibialis posterior. To palpate the fibular tubercle of the calcaneus, we can start on the distal phalanx of the fifth digit, moving over the middle and proximal phalanx onto the metatarsal. From here, I'm going to find the styloid process of the fifth metatarsal, and I'm going to drop off proximally until I get onto cuboid. From here, I can palpate posteriorly, and I'm going to palpate along the calcaneus until I find the fibular tubercle of calcaneus on that lateral aspect, and it's located just distal or inferior to that lateral malleolus. So that's the fibular tubercle of calcaneus, and the conformation is that it separates the distal tendons of fibularis longus and brevis muscles. To palpate the Trochlea of Talus, we can start on the patella, moving laterally onto the lateral femoral condyle, crossing over the knee joint onto the tibial condyle. From here, moving posterior and just slightly inferiorly or distally onto the head of the fibula, trailing distally along the shaft of the fibula until I reach the lateral malleolus. From here, if I move directly anterior from that distal aspect of the lateral malleolus, I can palpate the Trochlea of Talus. My confirmation for this is it sticks out more when I plantar flex and invert the foot. I can feel the Trochlea of Talus pop out quite a bit more. If I dorsiflex and evert, then it sort of drops back in. It's still palpable, but not as much. So my confirmation is plantar flex and invert the foot to really feel the Trochlea of Talus popping out into my palpating finger. To palpate the tarsal sinus, we can start at the patella, moving laterally onto the lateral femoral condyle, distally onto the lateral tibial condyle. From there, moving distally and a little bit posterior onto the head of the fibula, trailing distally along the shaft of the fibula until I reach the lateral malleolus. From the lateral malleolus, if I go directly distal to that lateral malleolus, so it's here, if I go just distal and a little bit anteromedial, okay, so towards the front, there's actually this small depression that you can place your finger in. And if I direct my pressure inferiorly, okay, I can feel into that tarsal sinus and I can palpate it in through there. So from the lateral malleolus, distal and slightly anteromedial, and I can put my pressure this way if I have my patient's foot bent. I'm sort of pushing towards that plantar surface, okay, in that little depression, and that's the tarsal sinus. The conformation for the tarsal sinus is Extensor Digitorum Brevis and Extensor Hallucis Brevis overlie this little depression of the foot. To palpate the intermediate or the second cuneiform, I'm going to start on the distal phalange of the second digit, crossing over the middle and proximal phalange of the second digit, palpating the metatarsal of the second, and feeling for the base of the second metatarsal, and the just proximal to the base of the second metatarsal is the second cuneiform just proximal. So from the base, I'm going to move off proximally, and this is the intermediate or second cuneiform, and the conformation is it's an attachment point for tibialis posterior. To palpate the lateral or third cuneiform, we can start at the distal phalanx of the third digit, moving over the middle and proximal phalanx, and proximally on to the metatarsal of the third. When I get to the base of the third metatarsal, I can move just proximally, and from there I'm on the lateral cuneiform or the third cuneiform. The conformation for this bone is it's an attachment point for tibialis posterior. To palpate the calcaneal tuberosity, we're going to start at the first metatarsal of the great toe, moving proximally onto the medial cuneiform, and then proximally onto the navicular. If I move towards that plantar surface, I'm on the navicular tuberosity. Posterior to that, I can palpate for the Sustentaculum Tali of the Calcaneus. And I continue to move posteriorly until I'm on that posterior aspect of the Calcaneus. From here, I can palpate onto the inferior or plantar aspect of the foot. And if I go with my patient's foot relaxed, if I go off center to the midline of the Calcaneus and I apply some pressure, I can feel the calcaneal tuberosity on either side, so the medial and lateral calcaneal tuberosities. The conformation for this is that it's an attachment point for the plantar aponeurosis, so it's a connective tissue that runs on the plantar aspect of the foot. To palpate Extensor Digitorum Brevis and Extensor Hallucis Brevis as a group, our starting point can be on the patella. We can move laterally onto the lateral femoral condyle, inferiorly onto the lateral tibial condyle, distally and slightly posterior onto the head of the fibula, distally along the shaft of the fibula until we get to the lateral malleolus. From here, we're going to move 1 inch distal to that lateral malleolus, and we're going to aim to be on the proximal, so this area of the foot, the proximal and dorsal lateral surface. So this is the dorsal surface and a little bit lateral. So proximal, dorsal, lateral surface of the foot. And this is an attachment point for Extensor Digitorum Brevis and Extensor Hallucis Brevis. So from here, I can start my cross fiber palpation. I'm going to resist extension of the great toe and digits 2, 3, and 4. So from here, I'm going to ask my patient to pick their toes up off the table. So try to lift them up. And I'm going to cross fiber palpate. So my palpation for the great toe will go to the proximal phalanx. And then for digits 2, 3, and 4, I'm going to go to the distal, good, and relax. I'm going to go to the distal aspect of 2, 3, and 4. And I can see those tendons of Extensor Digitorum Brevis there. To palpate Abductor Hallucis, we're going to start on the metatarsal of the 5th digit, traveling proximally until we reach the styloid process of the 5th, proximally until I get onto the cuboid, then posterior onto the calcaneus. I'm going to be on the posterior surface of, posterior surface of the calcaneus here, and then I'm going to travel onto the plantar surface, and then just off to the medial aspect, to the medial tubercle of the tuberosity of the calcaneus on this plantar surface. This is an attachment point for AB, Abductor Hallucis, so I can start my cross fiber palpation from here. And it goes to the medial side of the base of the proximal phalanx here. So I can start my cross fiber palpation. And what I'm going to ask my patient to do is try to spread their toes. So you're going to abduct the great toe. So you're going to try to push their toe into my hand, and then I can cross fiber palpate. I can feel the muscle really firing here until I get to that proximal phalanx of the great toe. To palpate Flexor Hallucis Brevis, we're going to start on the distal phalanx of the 5th digit, moving proximally over the middle and proximal phalanx of the 5th digit, going on to the metatarsal until I reach the styloid process of the 5th metatarsal. From here, I'm going to drop off proximally to look for that depression of soft tissue, and I press medially to contact cuboid. And then I'm going to move on to the plantar surface of the foot. So bring your foot up just a wee bit. Yeah. So on that plantar surface, so I'm still on cuboid. This is an attachment point for Flexor Hallucis Brevis, so I can start my cross fiber palpation. I'm going to ask my patient to flex the great toe, so they're going to try to push and try to bend their toe into my hand, and I can cross fiber palpate from here. And I can feel the muscle belly through here quite well. Good. I'll get my patient to relax, and then it attaches onto the proximal phalanx of the great toe, sort of on both sides. It's got 2 attachment points there and there. Okay, so that's Flexor Hallucis Brevis. To palpate Adductor Hallucis, we're going to start on the posterior calcaneus, traveling anteriorly along the lateral aspect of the foot until we get onto cuboid, passing distally up onto the styloid process of the 5th metatarsal. From here, moving distally along that 5th metatarsal and moving on to that plantar aspect. So I'm on the plantar aspect of close to the metatarsal phalangeal joint. And from here, I can start my cross fiber palpation. So are you able to turn your foot just slightly? Perfect. You okay like that? Okay. This muscle is shaped like the number 7. So it comes across this way and then down here. So it's going to adduct. When it shortens, it adducts. So I'm going to try to bring my patient's great toe away from her foot. I'm going to ask her to try to squeeze her toe back in. Okay, so I'll cross fiber palpate along the muscle here. And when I get to the great toe, I'm actually going to change direction and come down, try to pinch my finger. Yep, with your toe. Okay, to there. So this is Adductor Hallucis. To palpate AB, Abductor, Digiti, Minimi. We're going to start on the metatarsal of the great toe. From here, we're going to move proximally onto the medial cuneiform, and then proximally again onto the navicular. I'm going to move on to the medial aspect of towards the medial aspect of the foot, which is where we'll find the navicular tuberosity. And then posteriorly onto, lift your foot up, please. There we go. Onto the posterior aspect of the calcaneus. From here, I'm going to move, yeah, you can rest on me, got you. From that posterior aspect of the calcaneus, you're going to move on to the plantar surface, and Abductor Digiti Minimi has attachment points onto the medial and lateral tubercles of the tuberosity of the calcaneus. So I can start my cross fiber palpation from here. I'm going to ask my patient to try to spread the toes, so try to bring this pinky toe away from the other toes, and I can feel that muscle belly mostly right in through here, and I'll cross fiber up to the attachment point on that lateral aspect of the proximal phalanx, good, you can relax, of that fifth digit. Okay, so that's Abductor Digiti Minimi. To palpate Flexor Digitorum Brevis, we can start on the, bring this foot down just a wee bit. We're going to start on the metatarsal of the great toe. We're going to move along the metatarsal of the great toe until we get to the base. Proximally from the base is the medial cuneiform. Proximal to that is the navicular. We're going to travel medially onto that navicular tuberosity. Lift up just a wee bit. From here, I'm going to travel posteriorly, okay, onto the posterior aspect of the calcaneus, okay, and then onto the plantar aspect of the calcaneus. If I go medially, off center, I can contact the medial tubercle of the tuberosity of the calcaneus. This is one of the attachment points, so I can start my cross fiber palpation from here. I'm going to ask my patient to flex their toes from digits 2, 3, 4, and 5. So I'm going to place that resistance here. My patient's going to try to squeeze down onto my finger, and I can cross fiber palpate the muscle belly here, and then it becomes tendinous. So I'm going to actually ask you to relax, and then I'll show where it attaches onto both sides of the middle phalange of digits 2, 3, 4, and 5. So you're going to come up and show on each individual toe 2, 3, 4, and 5 for Flexor Digitorum Brevis.